Hello everyone, I hope you are all well and staying safe. Welcome to the BDA England live streamed event. We've done a series in December, we did one in January, and today is February's live stream event for BDA England. We're talking about well-being and loneliness and how we can support the deaf community. We have two guest speakers and we're very excited to discuss this with them. I'll introduce myself. I am Robin Ash from the British Deaf Association, the BDA. I'm really delighted to be here today as part of this live stream where we're going to discuss the issues of loneliness. And the reason we're here and why this is relevant, and we're really grateful that we have some funding from the UK government, Department of Digital, Cultural, Media and Sport. They've given us some funding to set up this project for the BDA, and this project will be, part of it is the live streamed events. Also, we're going to have some BSL videos talking about loneliness. And thirdly, I've been doing some visits to various deaf clubs, deaf groups, deaf schools, and I've visited several over the last few months, and the discussions we have been very, very useful, and there will be more in the future, and also another live stream. So before we go any further today, it's important that we have, and we've done this in the past when we do a live stream, we need to have some communication ground rules for everyone to know what to expect during this session. This means that while we're live, right now we're live, this is Thursday, the 24th of February at 2022, around 2 o'clock. We're going to be live for an hour-ish till about 3 o'clock. And while we're live, automatically it will be on the BDA Facebook. And then if you miss it and you think, oh, I wanted to see that, you can go back and look at our Facebook page later and follow the live stream. You may think, oh, I'm not going to get an answer because it's live and I've missed it. So right now on the 24th of February, you can make a comment and these will be raised during today. If you comment after the event, please be patient. We will come back to you and I will explain how the questions and comments will work. Part of the live streaming, which means that we're relying on technology. And as we all know, sometimes technology fails. For example, your Wi-Fi may drop out or ours may drop out, or it be a little fuzzy or frozen. And just to let you all, if this does happen, I apologize in advance. But don't panic, don't worry. We will try and make sure that if there are any hiccups, we'll try and get back as soon as we can. And if we can't, then we will let you know. It may be your own personal Wi-Fi when you're watching from home through the live stream. It may fade in and out. It might be your signal, or it could be your television that you're watching it on your mobile phone or tablet. Whichever device you're watching on, it might be buffering and you might think, oh, it's Robin or it's the BDA. It's not. It might be yours. And it might not have the strength at that particular time. Try and reboot and try and come back. But it depends on maybe some other people or other things that are using your Wi-Fi. If you've missed it, don't worry. You can go back and watch it, the recorded session on BDA Facebook. And then you can pick up where you left off. So it'll be there for anybody to access afterwards because it's a very important subject. We have two guest speakers who I'm going to interview today. You know, if you want to ask a question, you're more than welcome to ask a question. And we can pass that question on to our guests. So please comment in your Facebook. And at the moment, it's typed comments. If you want to do a BSL comment, unfortunately, we're not able to do that at the moment while we're doing it live. But in the future, we're looking into exploring how we can do that. But there's nothing stopping you to comment later with a BSL video. We may not see it straight away, but we will keep checking to see if there are any more further comments and respond to those. Comments or questions are important, and we welcome your interaction. The comments and the questions must be relevant to the topic in hand. We don't want it off point. And today's topic is loneliness. Please make sure your comments are not negative or critical. Please do not name people or organisations, because if they come up, we will remove them. It'd be unfair to name that person or organisation. And it must be relevant to a service. If you want to know something, ask a question and they will be able to respond to that, or maybe respond later. Please do not be critical. Those comments will be removed. So now we've gone through the ground rules. We're broadcasting to from the BDA office in London. Previously, I was in Derby, and I'm now in London office, because part of the project, I'm doing some visits to schools and organisations to talk about loneliness. So I'm delighted to be here, and I'd like you to join me with a very warm welcome to our guest speakers. The first guest is Kiran.
Hello there.
Are you well?
All is good. Thank you. And thank you for inviting me here.
That's fine. So can you tell me who you are?
I am Kiran, and I have a particular name sign that's key with a run. But as you can see how the spelling of my name is, I don't like the sign for run, but that's what it is.
Do you run?
No, I do not.
Maybe it's a future aim.
Maybe.
I mean, I have another guest speaker before I start to interview here, and I don't want to leave them out. We want to minimise the risks of loneliness, and we would like to involve this other guest speaker. So please join me with a warm welcome for Martin.
Hello there.
Are you well?
All is good. Thank you. And thank you for having me here as part of this conversation.
Can you tell me who you are?
So I am Martin, and I have a particular name sign for a cup of tea. And why is that? Because I love tea from a very young age. So I am well known for my tea.
So it means you make a really good cup of tea, seeing as you're from Yorkshire then?
Well, I try my best.
So I have to come and try one of your cups of tea one time, because I'm a tea drinker. Kiran, do you like tea or coffee?
I am not a tea drinker.
Maybe we should have a conversation about tea. We could talk about that for the whole hour, couldn't we? But never mind. No, we have to come back to the work in hand. So really, these two guest speakers are doing some awesome work, and I'm going to interview them and ask some questions. So Martin will be just watching this first session while I'm interviewing Kiran, and then if there are any comments or questions, we'll respond to those, and then we'll move on to interviewing Martin. So Kiran can watch. Okay, I hope that's ready. I hope that's okay with everyone. We're ready to move on. So I have a list of questions. I'm ready to start. So I'd like to ask you, Kiran, you told me your name, but can you introduce yourself? Who are you? What is your role? What is your organisation?
Okay, so I work in the Deaf Cultural Centre here in Birmingham. I have been here for 3 years to date in various roles, but currently I have two. One is the elderly coordinator on Friday, and then Monday to Thursday I'm the Befriending Officer. And that is the second part, is a new initiative, and it's quite challenging, quite learning, but also enjoyable.
I have to say a big thank you to Kiran for your assistance and allowing me to come and talk to your group about loneliness. We had a really good discussion.
Yes, many did attend, and it was also interesting, and it was such a good session to talk about the experiences and that realization of how many people were telling their lonely stories, but there was value to having that session.
I mean, thank you for your support and enabling me to be there and discuss that with your group. You mentioned befriending. Befriending. Deaf people will be asking, what does that mean? What is a befriender? Can you explain that?
Befriending is a project that has been funded by Barclays Bank, so they need to be acknowledged. It is something that happens around the UK, but nothing so much for the deaf community. And the reason for the funding is because they're deaf, hard of hearing, deaf blind, are experiencing loneliness without company. So this is why the project was developed to provide a service that will include a home visit, to have a conversation, have a cup of tea, have a conversation. Home visits can also include remote conversations that will happen on a weekly basis, setting up social groups around the Birmingham area, so including North, South Birmingham, Coventry, Solihull. So they will be established in all of those areas. So you don't have to travel long distances, but it's all about ensuring easy access for within the locality. And also there's an anxiety where you are left on your own and trying to get involved. And also we have to look about communication and breaking down that type of barrier and easing communication, encouraging people to become more independent, more social by getting them actively involved in social groups. And with that kind of establishment of these kind of groups, it's very useful for clients to encourage them to stop feeling lonely, knowing that there's something there that is waiting for them, knowing that there's something that can be done, and knowing that they can become actively involved in our social groups.
That is really interesting. Before I move on to my next question, would you mind me asking, why do a lot of people feel lonely? Why do they feel anxious going out? Why do they feel that?
There are a whole range of reasons. One is COVID. So there was that lack of contact causing loneliness. There was also mental health issues creating anxiety. But it's all about trying to encourage them to come into a safe space, making sure that they are compliant with the COVID requirements. And then there's some that are anxious about traveling on public transport, such as buses. That's anxiety around communication. And we know how important communication is, and that can cause a lack of confidence. So we thought it's important to provide an easier access to make sure that they all feel comfortable getting in touch.
Thank you for sharing that, Kiran. It's a really important subject. I think people who are feeling anxious or underconfident, they don't need to feel embarrassed about this. They need to be asking somebody for some help. Am I right?
Totally agree.
So in the audience, if you do feel anxious, if you're feeling lonely or underconfident and feeling a bit embarrassed, like this, it's important to tell somebody, ask for some support, and we'll talk about how we can move that support forward for you a little later on today. So I saw you said you got the befriending role, but you also had the other role that you mentioned, arranging and establishing a community day on a Friday. So why has that happened?
Okay, similar reasons to befriending, but on a Friday, and because of COVID and the building being closed, we thought why not set up an open event to allow the community to come back into the deaf community again and encourage them to provide activities, keep fit, lifestyle, and just providing all of that. And it's more of an opportunity, looking at your workshop as well, to learn more. And again, it's all about communication. And within the centre, there are other services such as benefits, housing, looking for work. And once they come in on a community day, it's a social opportunity, make new friends, but also the ease of communication and to encourage them to become more independent and to feel that they don't need to have that kind of anxiety, wondering about communication, wondering about interpretation, but it's opening the door for people to know that there's support providers and that there's that ease of comfort and knowing that they can also get support.
I can remember when I came along, it was very well attended and there was lots of activities going on. You didn't have to just do one activity. There were lots of different activities for people to join in. And I thought it was so diverse and it was lots of people there, which was really, really good.
Definitely.
People didn't have to be worried. So it's worth having a look. If, there's no harm just to pop in and have a look.
No harm at all, because what we want to do is be able to provide well-being, lifestyle, keep fit, you know, and they can, and also we provide interpretation as well. That will allow for ease of communication, that will allow for well-being. And for those that are elderly, they are unsure about traveling to events from their own home. What we do provide is a taxi service that we can pick them up from the home and drop them off at the service. So that kind of service is also provided. And again, it's all about encouraging them to become more confident.
Thank you, Kiran. Thank you. So if there's anybody that wants more information, please contact Kiran directly.
Absolutely, yes.
And the community day is open to anybody to attend.
Yes, get in touch. More than happy to do it remotely, let you know what kind of services we provide. You know, there could be one activity you may not want, but you might be interested in another activity. So please do get in touch.
Thank you, Kiran. So you talked about your befriending service and the community day. But really, why are these services, both of these services, the befriending service and the community day, why are they important? Why, you know, what are they for? You know, why are they there? Why have they had to be set up? And why are they so important for the deaf community? Why?
But a difficult question, challenging question. There are a lot of reasons. But the main thing is loneliness. It's about getting them out of the house. It's letting them know that there are facilities present. It's also ensuring that they can develop that confidence again. It's more of a repetition of what I've said before.
But if people are, for example, if I change the question, so if I said, well, if this wasn't there, if this service wasn't available, this befriending service wasn't there, what would happen to those people?
Their mental health well-being would worsen. Their mental well-being, it's thinking that they're at home, thinking that there's barriers to communication, not having company. Who can I be friends with? So as a befriender, we provide volunteers to suit their own individual needs, to have company every week, to have a conversation, to stop the feeling of isolation and loneliness. So it's to prevent that.
Just a supplementary question as well. So for a lot of people, why do they feel so underconfident? For example, you know, I may feel okay and I'm very confident with my life, but others don't. So why do they feel like that? Why do they feel so lonely? Why? You know, a lot of people will say, well, I'm all right. What's wrong with them? You know, what makes them feel like that?
Everyone is different. It could have been because of COVID, have become more anxious, fear of leaving the house, and also feeling excluded from family members, and also because of their own locality. There's no deaf people, and to think that it might be normal for them, but actually it's normal for everyone else. But it's more about having that common issue of communication and confidence.
It's a very difficult subject to broach. It's not nice to discuss this, but it's important that we do. And I think it's important that we think about other people, which is linked to my next question. So how can we, the deaf community, those that are okay, you know, dealing with this fine, how do we support and encourage those people that are underconfident, anxious, lonely? How can we help? A lot of deaf people have said, oh, we'll just let them get on with it, or I don't know how to do it, or it's not my problem. Some people do try and help, but how can we as a group support those to continue to participate?
Well, we engage with the local deaf communities. We develop partnerships. We provide mutual support. We support other clients. They support our clients, also working with organizations and to have mutual shared events. So it's more about they have their own clients. We have our own clients, be they deaf, hard of hearing, deaf blind, and also engaging with audiologists, hospitals. So it's more about giving them our support, providing information, and I have a BSL video showing what services are provided, what they can access to, and it's more about providing that support in a well-being approach with other organizations to support those clients. Now, recently I met with an audiologist because there was a person who was hard of hearing, and we can say, well, we have set up services for hard of hearing, and it's more about looking at, for them, It's providing posters for the audiologists, the hospitals, so that they can share that information. And it's about encouraging everybody within the deaf community.
So like you said, it's the best way to do it is to support each other and not work in competition, not pull other organisations down, try and work together.
We agree.
If we don't understand, that's fine. But if you don't understand, ask for advice on how to help. The befriending is not only for deaf. Is it hearing or deaf?
Deaf, hard of hearing, and deaf blind in the West Midlands. So we are there to support that population. And, you know, there are deaf befrienders, as we know, but our aim is to support the 3 different groupings.
So like a volunteer, could the volunteer, you know, somebody that wants to help, can they be hearing?
Or we're talking about the whole range. The Befriender Program is based on volunteers, those who are deaf, hearing, but with sign language competency, hearing loss, oral, because it's looking at the needs of the client. You know, it could be a case that the person wants a man rather than a woman. Also, faith, interest, let me think, what else? Race is also an issue, similar culture. So we look to fit the needs of the person. So if they are BSL, then we'll have a volunteer who uses BSL, because there's no point in having a misfit. You have to look at who's fit. And also, if somebody is hard of hearing, bringing along somebody who's hearing, but they need to have that awareness, they need to have that understanding. Also to think about the acoustics within a room, suitable venues for them, but making sure that those volunteers know how to support in a way that's suitable for them. And it's not about, it's about making the other person feel better. That's what it's all about.
So my last question that we've come to now, you can take a sigh of relief. But one question from me is, if a deaf person maybe lives in your catchment area of the West Midlands, if they feel that they're struggling, they're not coping, they don't know what to do with themselves, they're feeling lonely, or they may feel fine and they want to volunteer to help your befriending services, how do they make contact with you, Kiran? How do they, you know, make contact? How do they let you know?
Keep an eye on social media. My contact details are always there on the poster, and Facebook, Instagram, Twitter. So get in touch, let me know, and we can do a remote video call. My number is there, and I'm happy for people to make a video call. Don't be embarrassed, don't be ashamed. Let us know. We can tell you what service we provide. You can tell us what it is that you would like to have in terms of support. And if there are any volunteers out there that are interested, please do let us know, because we want you to get involved so that you can share your experiences with others. And it's just a very nice feeling to have, knowing that you can provide that kind of support. So please do let us know if you'd like to be a befriending volunteer. Get in touch with us for more information.
For deaf people, they may feel a little worried about confidentiality.
Absolutely. Confidentiality is crucial. And also to consider GDPR. No information is relayed anywhere. And a written agreement will be sought to ensure that there is confidentiality put in place.
So I've done my questioning of you now, Kiran. It's very useful to have an idea of what your service provides. So if there are any comments on Facebook, I'll just check.
Okay.
Bear with me, I'll just check. So there's no questions so far.
Thank you.
I think the information you've given has been very clear, but nothing to stop any questions coming later. So if there are any questions, will you answer them later?
More than happy to do that.
Thank you, Kiran, for explaining your service and the work you do. Thank you very much.
Thank you.
Over to you, Catherine.
Yeah. So, Martin, over to you. Where is my cup of tea?
Unfortunately, it's all run out. You've drank it all.
Drank it all.
Yeah, I'll have to slow down. I drink too much tea, I think. I have to take my time a little.
Yorkshire tea is what I would like. Okay. Martin, introduce yourself. Who are you? What is your role and what is it that your organisation does?
So my name is Martin. My surname is Martin, is cup of tea. I'm operations managing for the local care service for Action Deafness, in brief AD. I've worked for AD for over 5 years now. I started working there as deputy manager and have now been promoted through various reasons, through projects, and we've increased our service to the community.
Congratulations, well done. And Kiran, congratulations to you on your promotion as well. It just shows that people can, and that is essential, and it's good to see. Martin, you spoke about community care services. What does that entail? What does it look like? Can you expand on what it means?
Really, when I started to work, I was working with the community, supporting people one-to-one as a PA, personal assistant, the PA. So it's a support worker. So about 3 years ago, we started to register with CQC, the Care Quality Commission, which means we can provide personal care as well to the elderly, deaf community. So we have 2 avenues, the community PAs who support that work, and then personal care services for the elderly people. It might be somebody who may have 4 calls a day. They want, a lot of agencies have hearing people, so deaf people can't communicate with them, and they find it difficult to access. So we can work on a one-to-one basis. We can meet their communication needs as well as their care needs, so that they are, if they want to get ready in the morning, they don't want an interpreter there, where their carers are already anxious enough as it is, and somebody that can sign and work with them on a one-to-one basis makes them feel better.
I remember in my previous position as a social worker and undertaking assessments for individual deaf people in terms of the care that they require. However, in terms of other services, they are not able to sign, and how were they able to communicate with clients? And that was quite difficult because there's the communication element of it. So it's good to see that you're providing the communication aspect of it as well. In terms of support services and community care, why is it important to provide this particular type of care?
Really, the main thing is to make sure that people have their right to access information, what's out there. So if something's in too much written English, their first language is BSL, and they may not be good at reading, they might not understand the content, and the worker can work with them to make sure that they understand the content of that information by translating it into BSL and making sure they have access to community events, deaf clubs. They have welfare centres and interpreter support, and we go with them just to access these services.
Now, through the work that I do and traveling around the place, looking at what you provide in terms of PA support to individual clients, do you call them clients or service users?
We call them clients.
Okay, because obviously there's variations in vocabulary. But so you talk about providing this type of care, but I do remember a situation where a person was talking about loneliness, and I had to thank the PA for allowing that person to come along and to be able to travel with them, because without that PA, they would have been at home. And that was a very powerful message, to watch this PA to enable another person to have that type of confidence to go to some place and to be able to stand up and speak. So looking at what a PA does on a daily basis, what does it look like? Is the work range different? Is it a case that they are stagnant and remaining in one position? Exactly what do they do?
Really, it varies. It depends on what the client wants and needs. Our philosophy is the person-centered care support. So we are all about them, that person, what they want to do rather than what we can do for them. And we have area of staff. We meet our clients with staff to make sure that there's that perfect fit. Some may have 2 hours every month, and some may have 24/7 support. So it depends from person to person. Some may focus on mental health. Some may focus on their anxiety. It could be somebody that's been in prison before and they're out in the real world again, and how they deal with that. The communication, the support is there. It varies from person to person, and it really does depend on their initial assessment, what they want to develop for themselves, what they want to improve, increase their confidence, allow them that, you know, ability to go out and about in the community.
It's quite impressive to see that range. Now, this is for the both of you. What is the difference between a PA and a befriender? Is it a paid situation? Is it working as a volunteer? What exactly is a PA?
All our PAs are paid for the work they do. They have a training program that we take them through. We have a basic care certificate training so that they understand their roles, any conflicts, any safeguarding. And the care certificate is from Care for Care. It is very English based, and we've had to modify it and add the BSL aspects of it too, so that any staff that start working for Action Deafness learn this information, learn their role before they actually get out and about with clients. And it's a paid role.
So knowing that it's a paid position is good. Befriending obviously is important. PAs are obviously important. But how does a person decide which service to utilize? What service can they utilize? Can a deaf person be guaranteed a PA? Is it an automatic provision, or is it dependent? Can you explain that a little bit more for me, Martin?
I mean, really, Kiran, might be better to talk about the befriending role, because it's more of a social model. It's encouraged them to talk to them. It's been more sociable, making them feel happier inside. Where the PA is working with things like letters, bills, moving house, accessing services, welfare services, in-depth work, in-depth stuff with them.
Okay, so Kiran has already spoken about befriending and how to make contact. Can a deaf person get a PA just like that? Now, how does it work?
We are always looking for more deaf staff. We've got 85% of our workers are deaf. They're all native BSL users, and the rest have a minimum of level 2 BSL, because some of our clients, as Kiran said before, some prefer hearing people. We have to make sure we have a range of support officers that meet their needs. Sorry,
I probably wasn't clear. I've been so enthusiastic about the importance of the information that I'm not make my questions very clear. Now, if a deaf person wants a PA to do a home visit, can that be acquired easily? Like what's in place for them?
There are two routes. One could be a self-referral. They can go on the website. There is information that they can type in to contact us directly. We can come out, do an assessment. We can talk about their needs and what they want to see happen. And the other is through social services. They can talk to their social worker and say that they want a PA, and then they will do a referral. So there are two avenues into this.
How interesting. If a deaf person decided to make an application for a PA, they would need to contact social services. But how would they know where to get social services? Because as you know, that type of service is on the decline. So how do they make the application? The majority of contact can only be done by phone or by email. So how do they make that initial contact to start the process? So can you give us an example of how the process works in obtaining a PA?
You're right. That is one of the main difficulties we've faced over the years, because if they don't know what service is available, how do they know? You know, if they can't talk to social services because they can't access, or they don't let us know that that person needs a PA, it's very difficult to do that. And we do try and build up a relationship with local social services around the region so that they know what we deliver, what we can help, and our processes. If there's been an accident or an ambulance has come, the police have got in touch with social services. They then can also alert us, so we can give that additional support for those deaf people. We can make sure that, you know, both sides know what we do.
And can you support a deaf person who is unable to contact social services or have difficulty in accessing that, or having a specialist deaf social worker of some description? Are they able to contact you to make that contact?
Yeah, they can let us know and we can intervene. We can help them contact their social services and bridge that gap between the client and the social services. You know, we don't want to be seen as encouraging our service, but if they do let us know, then we can bridge that gap. We can then, if we are commissioned to do an assessment, get the budget sorted and provide that support.
So there is payment for support. There is payment for PA support. Now, how does the payment happen?
It really does depend on the personal information, their personal financial situation. If they have a lot of money in the bank or minimal money in the bank, it can come under direct payments, and they will cover that cost for the services.
That's good to know. Looking at Action Deafness, it has been expanding over the years, hasn't it? So tell me, how has it expanded so much? Because there are service gaps, there is a need for the type of services, and how is it that it has expanded?
It has grown. I think it's managed growth. So, you know, we've grown in a way that we can manage it. The deaf community, you know, we used to start with maybe 8 hours a month, but now we're doing like 2,500 hours a month of support.
Wow.
And obviously there is more, especially through COVID. Councils have cut budgets. Some support services have been taken in-house. So deaf people have been left with nothing, and they've come to us for their support. And those isolation, especially at the beginning of COVID, you know, not having access to the television, not having access to announcements. Deaf people didn't know what was going on, and they became more anxious, more worried about what they should do, what they could do, what they couldn't do, which caused more anxiety than anything. And we've tried to keep in touch with them remotely, visit them depending on circumstances and restrictions. And now these new restrictions are, you know, being lifted. You know, we can explain to the deaf community what these changes are and how they're updated.
That is a huge expansion. Now, is it a case that the deaf person can only choose you, or are there choices out there?
There are choices. There's always choices. There's many other agencies. For example, we may get a referral from a region outside of our coverage, but we know there is a deaf service there. So we will pass that client to that service that are more able to deal with them, support them, because they have that regional coverage that we don't. So there are other agencies.
Quite impressive, knowing that you can engage with other services too. That's really good. Again, it's a question that has already been asked, but looking at our deaf community, how can we support your services and your clients and your PAs to access community events? Take, for example, deaf people will say, I won't do anything. Let's say a PA arrives at an event and let the deaf person there. But how is it that the person can engage with the community? So can you describe what it is that you would like to see as good practice to enable the clients and the PAs to become more actively involved?
I think it's important to have good communication with that organisation or the organiser of that event. I mean, like, for example, a BID event, we may have some clients in Birmingham. You know, Kiran, if she keeps in touch with us, we can tell our clients, we can take our clients along to that event so that they can interact. And I think communicating and sharing what we do is important. And we also encourage clients to go, so it promotes their independence. So when we arrive, we don't want the deaf community to see the deaf client with a PA. We want to see them as independent so that they can participate in the activity, and the PA can stand back a little bit and let them be themselves with their community. Initially, it might be that we encourage them to participate, and we have strategies to work with our clients so that they're more independent in the future.
Like, as we progress, we sometimes forget these kind of issues and the importance of how staff are going to be using it. So there's just that element of caring for the volunteers and the staff as well. So it's more about ensuring that staff, volunteers are looked after in terms of encouraging them to be part of social events. Do we provide them with free drinks? What do we do?
I'd rather see, somebody working with people, being part of the events rather than being on the sidelines. So we're more than welcome to be part of whatever activities are being planned.
It may be somewhat of a strange question, but it does happen where deaf people are unsure what to do, including myself. Should I do this? Should I do that? So all of this is part of the learning process. So thank you for sharing that.
So I think,
I think based on what it is that we have had to say, I think that's it in summary. I think there is a question that has appeared. So can you raise the question on the screen, please? Okay, so looking at the question is, I know that there are PA supports, but I'm looking for an agency that can provide deaf support staff. And Robin is just frozen, so just bear with us. With staff with good sign language skills to support within a care home environment. But most agencies provide care support staff that send out hearing staff that cannot sign. Is this something that you can provide? And this question is for you, Martin.
Definitely. Definitely we can provide. We have provided this in the past. For example, an elderly person has gone into a care home, and 99% of all care homes in the UK are hearing staffed. There's very limited deaf awareness, which is a common theme. So we've identified deaf people who may go downhill quick because there's no communication. So we have a PA service, a communication support service, where we encourage them. We go in, we make sure that they're all right. We talk to them. We talk to the other hearing residents. We try and bridge that communication gap. We put posters up. We put pictures up. We take pictures of different things. So we do support that.
So in answer to that question is that your organization can provide care. So that's the answer. It is possible. Well, because of that question, it's caused me to think of another question. Sorry, Martin.
You're welcome.
Looking at the issue of care homes, deaf elderly do have an anxiety about going to a care home because they don't want to experience that loneliness and isolation within a care home. What can you provide in those settings?
Any person really who, wants to stay in their own home. They don't want to go into a care home. And it affects them more because they're mixing with hearing people. There is the one, the Isle of Wight, which is a deaf care home. But the rest of the UK, there isn't any provision. So we are looking for something in the future to have an extra care home. So like in Ireland, there's a village where deaf people can live and, visit. So I think looking for a community for elderly deaf people, we're looking into.
And also, isn't there a deaf care home in Holland whereby there is a specialist setting particularly for deaf people. Wouldn't it be lovely to have something like that here in England, apart from the Isle of Wight? Why not dotted around the UK? Again, on the issue of the care home, if there is a deaf person that is there on their own, can you as an organisation attend? Because you know that there would be other deaf people that would say, I'm concerned about such and such in this care home. Can you pop along for a visit?
It does really much depend on which area they are from and if we can cover that. For example, we could provide, depending on circumstances, but yes, we can provide that support.
And Kiran, is that the same for you? Okay, so there are
the West Midlands. So, you know, we have one person that's in a care home that's been very isolated, and we have contacted all the care homes to look for deaf or hard of hearing people that we can provide befriending service to, half an hour or an hour a week, or, you know, maybe get them along to the day, the BID day on the Friday. A lot of people have said how lonely they are. They don't understand what's being said. They can't communicate with their staff and peers.
It is an important topic to discuss, isn't it? And I appreciate that. Are there any other questions? If so, can you just put that on the screen now, please? So this is a question for Kiran. Would an event held in Birmingham be necessary only for the Birmingham area, or can it be for anyone outside of the Birmingham area to attend that event? So can people go to Birmingham? And also in relation to you, Martin, that same type of question. So Kiran, can you answer that question, please?
So yeah, anybody outside of Birmingham are welcome to come to the community days on a Friday. Anybody, people from Walsall, Wolverhampton, Redditch, they're more than welcome to join us. And also...
And I've been one of those people. You welcomed me.
Of course.
I came from Derby. So yes, the answer is yes. So and if you come from any distance...
So we would welcome any deaf, hard of hearing or deaf blind. We want to open the door and we want to be open and accessible so anybody can come along.
Martin, what about you?
I mean, really, we don't set up community events as such. You know, we do have work in certain areas. So if there's a coffee morning, we could set up it, say, in the Worcester area or, you know, whatever, we could go along to that.
And also, looking at the support is being dependent on funding. But if you're looking at community days and coffee mornings, they're actually quite open, aren't they? And it's an opportunity to come together, meet new friends, to find out information, to enable confidence to grow. And obviously that's something that AD do, is the establishment of coffee mornings, which is something that deaf people enjoy. And what people also like is that opportunity to have a range of choices as well. Are there any other questions? Just going to do a quick check on Facebook. No, that's it for now. There's no questions. I do have one or two questions that have been asked of me because the others were at work. So the questions that they have asked me to ask you is, because of work, I am lonely. Why is it that there are more and more clients that have become lonelier? Because back in the day, it was less. Why is it that there seems to be, why has it become more prevalent? Why is it more than ever? Obviously because of COVID, but it even happened before COVID. Why is it that people are having to have this kind of suffering happen for them? Any ideas why?
I think previously with social media, there was no mention of loneliness. And I think that has made people think, well, actually, I do feel lonely. I feel the same as that. And I'm not embarrassed to say that I feel lonely and I need some help. People are starting to listen and are more willing to say how they feel. whereas before they would probably not, even if they felt lonely. Some people wouldn't really not understand what that feeling was, and they wouldn't go to the local community. They would think, oh, I don't fit in, and they wouldn't think about how they would portray themselves and how they introduce themselves. But I think now people are being more open about it and saying, I actually feel lonely.
I think you might be right. And yes, it could be the case that in the past it was hidden and now it's become more open. Martin, what do you think?
I agree with what Kiran's just said as well. I think social media has had an effect on people. And I think it's the increased cost of daily living, people managing events, managing buildings, costs have gone so high, and people have less place to go. People have nowhere to go. The community's not there as it used to be.
The world has changed. Society has changed. And also it's creating that balance. So yes, there is change, but also that openness and more awareness as well. Okay, so another question has popped up. So can that question be put on screen, please? So hats off to the both of you for providing great and invaluable services, but hearing people and professionals, for example, the NHS, social services, to be told about this in case they know someone who is deaf and lonely. And how about advertising your services via the local community hospital, radio stations? So over to the two of you.
I think it's a fantastic idea. I've never thought about using the radio. I think it's worth me making contact and talking about the service we provide for deaf people. I think we're too focused on BSL access rather than thinking, flyers and posters for deaf people, rather than how we attract a hearing audience and make a hearing audience understand. So it's something to try. Thank you. Martin,
Right.
yeah, I agree with what Kiran's just said. I think it's more about deaf awareness as well. If they don't have any awareness of deaf people, how can they signpost to the right organisations? And hopefully within, March the 18th, this BSL Act will be packed at this third reading. And I think this will encourage hearing people outside of these organisations to change, hopefully.
That has now caused me to think of another question. Looking at the barriers that people face, particularly in relation to social services and the NHS, because of lack of awareness on their part. So what kind of plan could be put in place to create that awareness and that understanding, and to acknowledge that these type of services exist, rather than allowing people to suffer in pain longer than it is needed, to provide earlier intervention and support? So any ideas about how you are able to encourage the NHS and community support services, because they hold the money. They're the ones that do the signposting. They're the ones that are doing the referrals, but they're the ones that don't know. So how can you raise that awareness with them? I know it's probably a difficult question, but over to the two of you.
A very difficult, but good question anyway. I think we're just going to have to carry on that work we do, working with different organisations, community groups, activities that we do, and talk to the commissioning teams, the senior leaders, those that hold those budget strings, within the councils. We're going to have to continue that work. We need to keep telling them what we do and how we can help them help their clients. How we can support them using our staff makes it easy for them. So they're more aware of the fact that we're here and what we can do. And I agree with Martin, we just have to continue to work with other organisations to talk about the services we provide. So I know now things are starting to grow. People are becoming more aware. And I think we just need to carry on that fight, and try and encourage them to use us.
Right, okay. What you have provided is a wealth of information, providing this conversation to start thinking about community care. Before we come to an end, are there any other final questions on Facebook? Let's do a final check. Nope, that's it for now. Okay, so we have a few minutes remaining, and I will finish off with one final question. Looking at the issue of loneliness, we don't want people to feel embarrassed. We don't want them to feel embarrassed asking for help. There is that embarrassment, there is that shame. Why is that? Why is there an embarrassment to ask? And how can we support them to say it is okay to ask? So, can you give us any tips about how to tell other people that it is okay to ask for help? It is okay to ask for support. Martin?
I think that's difficult to answer. We try to become a good role model for our deaf community so that they know too, we can empathize with them, and hopefully they can see that and follow that same model. Support somebody to go along with somebody, somebody to say how they feel. We can't force somebody to come to our service, and somebody may have to make the first step themselves, but then we can work with them for their future. Kiran, also, like you did the loneliness workshop, more of that needs to be done. When you came, a lot of people said, well, actually, I felt like that myself, and I didn't realize that's what I was. And I think having that empathy with other people and realizing you're not the only one that feels like that. So if people haven't got the confidence, I know people talk, but we will be confidential. If you come to us directly, we will not mention your views or what you've said to us to anybody else. You can come into a group, you can open up in a group, and you will realize that a lot of people have some sad and painful stories to relay. And you may then gain that little bit of confidence to say, actually, I feel a little lonely and I need some help and support.
What a perfect summary. Thank you both. I think it's important now that we bring this to a close, and part of our project is all about ensuring that deaf people get the opportunity to watch programs like these and to think about, the life experiences that life changes, things happen. And if people want to know more about loneliness, then it's good to attend to those workshops in different regions. And if a person is interested in a workshop, do let us know, and we can let you know where events are happening, such as Newcastle, Gloucester, London. So let us know where you are, and we can inform you of that information. And then in terms of if your organization wants to host an event, get in touch with us and we can organize something. So if there is the experience of loneliness, and it does happen to all of us, it is okay to feel lonely. It does not need you to feel embarrassed about it. But if it is a persistent type of loneliness, then do ask for support. Do look at different opportunities out there. And based on what it is that we have seen to date, is that going to a workshop will give you tips on how to decrease that sense of loneliness. And it's thinking about, those people that say, well, I don't feel lonely. That's fine. But think about the others that do. And when I do my tours, be that in the playground, you know what it's like in the playground, where you go to a deaf club and people are in cliques. So think about, how do you support those? And what if a person has not turned up and they're now remaining at home? And look at all of the reasons that both of you have talked about. Think about how to get them back into the club again, and look at what is being provided through the BDA and obviously the befriending service. So if you've got those kind of ideas to be set up in other places, do let us know. And I would love to see this happening in more areas, and also with the Action Deafness and looking at how the PA service has expanded and the use of signing staff to ensure good provision of care. So it's good to see those expansion. It is good to see those opportunity and choices, because at the end of the day, it's about quality of life and feeling engaged. And today's conversation, I would like to thank you, Kiran, and allowing us
Thank
to
you for inviting me.
And Martin, thank you too.
Thank you very much for inviting me too.
I really enjoyed this conversation, a really lovely chat. I wish you both the best of luck with your services in the Midlands and also Action Deafness in all of your regions. So the best of luck to the both of you. And I would like to thank our audience and for the questions that have been asked today. On completion of this live event, if it's a case that, what a pity I've missed it, you can put in questions at a later date and we can respond to you. We'll also get in touch with both Kiran and Martin to also respond as well. So feel free to ask questions at any time. And if it's a case that we might have to explore and answer, have patience with us. Also, as a final note, I would like to thank our two interpreters, Lisa and Catherine, who have been providing the interpretation into English behind the scenes. I would also like to thank my colleague Peter, who is our tech guide today, to ensure that this can be provided live. So thank you very much. We will be having another live stream next month. Not going to say who, so keep an eye in this space. But if there is any information that you want regarding today, get in touch with us. And for now, good luck.
Thank you.